Give me 1 second, please. All right, we're ready to convene the Substance Use Awareness Committee. I consulted with our chair, Meredith McKenzie, and due to some personal issues, she has come in late, and so that I've prepared to chair this committee, and she's agreed that that's okay with her, so that's what we'll do. So thank you, Meredith. And I guess I've appointed myself to be chair, so I need to check in with legal to make sure that that's okay.
Mr. President, you can do whatever you want.
I love this job.
I don't know if you want to really say that.
All right, let's call this committee, subcommittee to order, and we'll take a roll call.
McKenzie? Here. McKenzie here. Chan?
Here.
Chan here. Chappelle Ingram? Here. Here. Chappelle Ingram here. Stewart?
Here.
Stewart here. Witcher?
Here.
Witcher here. We have a quorum.
Thank you. So we're at item number 2, approval of the August 10, 2017 Substance Use Awareness Committee meeting minutes. Any comments?
Move to approve.
Second.
Witcher.
Any comments?
Yvette, I'm Chappelle. Second.
Go ahead and take the roll.
Okay. Chan?
Abstain.
Chan abstain. Chappelle Ingram?
Yes.
Chappelle Ingram, yes. McKenzie?
Abstain.
McKenzie abstain. Stewart?
Yes?
Stewart, yes. Witcher?
Yes.
Witcher, yes. Motion passes.
Thank you. We're now on item number 3, Diversion Program Report and Statistics. I see Carlos. Welcome, Carlos.
Thank you very much. Good afternoon, committee. Carlos Alvarez, Enforcement Chief. And I'm here to present the Diversion Program Report and Statistics for the first quarter, July through September of 2018. And there hasn't been any significant changes at all. From July through September, we had 2 self-referrals. And so currently right now we have 14 active participants in the Maximus Diversion program. And so currently right now the board is recruiting for a public member position in the northern deck, 2 dental positions on the southern deck, and 1 physician, 1 psychologist position on the southern deck, and a dental auxiliary position, both northern and southern deck. And so currently right now the next deck meeting is scheduled for January 9th of 2019 in Southern California. And so like I go back and reinstate it, there hasn't been significant changes to the program or referrals. And then as you know, tomorrow on Friday, there'll be another presentation on the diversion program.
And Carlos, I was going to ask if there were any barriers that are in place that are preventing our members but maybe that discussion would be better held for tomorrow when we have that diversion discussion.
Yes.
Do you agree?
Agree.
You agree? All right. Comments from the board, subcommittee for Carlos? Public comments? Seeing none, thank you.
Thank you.
Moving on to item number 4, update regarding the October 23 statewide opioid safety work group meeting.
Good afternoon, Alexander Burdañotis, Enforcement Manager, Investigative Analysis Unit. I've attended the meeting on October 23rd of the statewide opioid safety work group meeting, otherwise known as State SOS work group. 7 work group priorities were identified for the 18-19 year. 1 was strengthen the work group infrastructure to improve effectiveness and expand collaboration. 2 was to promote increases in treatment infrastructure, harm reduction services, medication-assisted treatment access, and naloxone. 3 was identify and prioritize best practices and policies for priority populations. 4 was promote and support expansion of data sharing. Number 5 was identify, promote, and support implementation of effective policy and practice resolution. Number 6 was support, promote, and coordinate communication, education, and awareness efforts among SOS workgroup partners and other state and local stakeholders. And lastly was to support local opioid safety coalitions and community engagement. The California Opioid Overdose Surveillance Dashboard is an ongoing collaboration between the Department of Public Health, Office of Statewide Health Planning and Development, Department of Justice, and California Healthcare Foundation. There are 2 dashboards, and they are located on the Department of Public Health website. One is the state information, and the other is the county information, where you can go and you can sort and look for information specifically by geographical area and zip codes and identify trends. For example, the statewide average of prescriptions per 1,000 residents in the state of California is roughly 530 prescriptions per 1,000 residents, whereas Butte County and Yuba County are almost twice that area, twice that number, of 1,036 for Butte County per 1,000 residents, and 1,012 for Yuba County prescriptions per 1,000 residents. In Marin County, it's significantly lower at 414 prescriptions per 1,000 residents. And Los Angeles County, surprisingly, is only at 390 prescriptions per 1,000 residents. The final data was also updated on the dashboard for 2017 for the statewide totals. And the total opioid deaths for the state of California was 2,196 in year 2017. Fentanyl overdose deaths was a total of 429. Opioid overdose emergency room visits were 4,281, and that excluded heroin. And the total prescriptions in the state of California for the year 2017 was 21,787,042 prescriptions. The grants that have been given to the Substance Abuse Mental Health Services Administration through an interagency agreement with the Department of Healthcare Services, there were 2 for federal fiscal year 2018-2019 and 2019-2020. And both of those grants were for $1,950,000 each year. The Department of Public Health has also received a prescription drug overdose prevention initiative of $2,632,077, which includes support for the SOS work group. Legislation. Under existing law, the Dental Practice Act requires mandatory courses by the board for license renewal to include a board-approved course in infection control, a board-approved course in the California Dental Practice Act, and completion of certification in basic life support. Senate Bill 1109 would add the risk of addiction associated with the use of Schedule II drugs to the dental board's area of continuing courses. Assembly Bill 2487, which is titled Opiate-Dependent Patient Treatment and Management. This bill authorizes a physician and surgeon to complete a one-time continuing education course on opioid-dependent patient treatment and management as specified, and an alternative to the mandatory continuing education course on pain management and the treatment of terminally ill and dying patients. Senate Concurrent Resolution number 115, titled Opioid Crisis, The measure would recognize the impact opioid-related deaths have had on California communities and would support groups and organizations working in California to combat the epidemic. Any questions?
Subcommittee comments? Question, please?
And I don't know if you have the answer to this, but in terms of the, what we call the opioid crisis, can you give us a description of, what is the genesis of all this besides the doctors writing the prescription? Can you speak to the genesis?
Well, I can speak to some trends. What the initial push for, or the initial crisis, how it began, I would have to do a little bit of research and get back to you and report back to the board on that, on the initiation of the entire crisis and what steps have come up to now.
I'd like to answer that just a little, if I
Sure.
may add to that. That part of the genesis of this problem has been over the last 20 years, and when you look at Big Pharma, when they were pushing these drugs and they were marketing them as relatively safe, you're not going to be addicted, and they hired people to go out and market their product, and those folks were very creative and they were very good at what they did, and so believing that they were pushing a product that wasn't particularly addictive was one of the factors that led to where we are today. Today we know that we know differently, that those studies were probably insufficient. Some of them were flawed, and here we are. Does that help?
Well, I halfway knew the answer. I just wanted to hear it from you. Okay.
I would have to report
And
back.
that would depend, the genesis would depend on how you would solve the problem. Would you agree?
I would agree.
Okay.
I would agree.
If there was a lack of education that led to the problem, then I'm going to suggest that bringing in more education might be part of the solution. And we're going to talk about that today.
That's correct, and that's what the coalition and the the work group is focusing on. And very well said earlier, I just didn't want to misspeak on.
Thank you.
Thank you.
Further? Steve?
I have a question. Opioid deaths are a tragedy, but the greater cost to health care is the transgression from introduction of the opioid to addiction. How do we track that?
Well, there are trends that are being tracked right now as we speak, and this is what the work group is doing. There's multiple studies that have occurred throughout the state, throughout the United States. Again, I would have to. I don't have that information right now. I'm happy to report back on specific trends, specifically with that question.
And then the subtext for that is that we've seen a couple of vignettes now where the greatest increase apparently of addiction is identified in the age range of 10 or 11 to adolescence. Describe more of that. That seems to be not just a morally vulnerable, but it's drugs don't work the same on kids. Pharmacologically, it's dose related. They don't have the tolerances that adults have. How do you measure something like that?
Well, interestingly, the trends with opioid addiction is actually in the 20s, and then there's a pause, and then again in the 40s and early 50s. So those are significant increases in those age demographics. There's other factors that play a role in it as well, but the trends don't necessarily suggest that young in the opioid crisis.
Thank you.
Dr. Chan will also have experts available tomorrow during the diversion program presentation that we held in the morning. So that question can also be asked of them.
Thanks.
Further questions? Public comment? Thank you.
Thank you.
All right, we're now on item number 5, discussion possible action regarding the development of a regulatory proposal to require the completion of mandatory CE relating to the risks of addiction associated with the use of Schedule II drugs as a condition of licensure renewal. And I thought what I might do just to start this discussion is go back and kind of remind us in terms of what where we are and what this next discussion might focus on, and that might be a help to this committee to get the conversation started. So with your permission, just a very short review. During the 2018 legislative session, the board voted to support SB 1109, authored by Senator Bates, which adds risks of addiction associated with the use of Schedule II drugs to the board's area of CE. At its August meeting, the board voted to move forward to develop language and course criteria for a mandatory course. At the upcoming meeting on November 29th, the Substance Use Awareness Committee will begin to consider what language to include in regulation, such as how many units will be offered, the course content outline, whether this mandatory CE will be a one-time requirement or ongoing for each 2-year renewal period, similar to the board-approved required courses of the Dental Practice Act and Infection Control. Additionally, the board will be looking into what other states require for CE in response to this crisis. And it goes on, we go on to describe what they're doing in Pennsylvania. And I know that Dr. Witcher was very helpful in forwarding some information from one of the states that he reviewed, which was Florida. And Bruce, if you'd like, I'll let you take it over from there, and maybe we can get this conversation started.
Sure. Thanks, Tom. Yeah, you know, in preparation for this discussion, I looked around to see what other states were doing, and this was not an exhaustive search by any means, but there are quite a number of states that have required courses for dental practitioners. New York, Pennsylvania, Texas, Florida, North Carolina, Massachusetts, and Washington just were the ones that I happened to look at, and there are others. You know, it's the way they structure it, it varies a lot from state to state. Usually they seem to require between 1 and 3 units. I'd say the average was 2 units per renewal period. Some states have 3-year renewal, some states have 2, a few have 1. And so that's kind of seems to be where that is. In terms of whether it's a one-time or ongoing requirement, I found both. Some states structure their required courses differently. In other words, some don't have specific board required courses like California, where there is specific content in regulation. A lot of states just approve ADA CERP approved courses and recognize those as fulfilling the requirement. And of course, most allow completion via distance learning for CE nowadays. That's kind of the standard. The content usually requires specific content related to the state laws in that particular state, and also use of the state prescription drug monitoring program. And some actually just incorporate by reference courses offered to medical practitioners. And although they're good courses, some are quite lengthy. Everything you want to know about addiction management and chronic pain and everything, end-of-life issues, all that. That may or may not be ideal for dental practice. There's a number of free courses offered on the internet. They're not hard to find. There's a lot of information. The ADA has a really good website on opioid crisis webinars, and there's a number of course offerings on there. So there's no shortage of information. It just decides on what we want to do. And so, you know, I would propose a couple of things. One is we look at something in the range of 2 units, that it would be required per renewal period, but I would not like to leave this open-ended because some of the required courses lose some of their learning value just due to information fatigue, just going and taking this thing, you know, online year after year after year. So I don't know if there's a way we could do this, but could we put in a sunset provision where maybe we re-examine what kind of effect this is having and whether we're getting through or, you know, I would just think it would be nice not to have this just open-ended.
I'm not sure if this would be an issue to add to the sunset review.
Right.
I think it would have to be well, I'd recommend that it be a separate issue.
Right, oh, yeah, I would think, yes, I would not propose this for sunset review.
Yes.
I mean, I guess what I would propose is that we start developing draft regulations for a course. We look at it being 2 units per renewal period initially. That, you know, as a future item, we discuss whether we want to make this ongoing or, you know, have an end date in mind or a reevaluation process where we look at how effective this is. You know, the educational content, that's always hard to come up with. You know, I don't know that anybody's ready to do that at a committee meeting today. And so I would just like you to look at what I pulled up. And actually I have a more extensive set of references that I could share with you. And it's just not exhaustive at all. This was very, very much an initial investigation. But maybe it'll get you looking at some stuff and thinking about it a little bit, and we could bring it back. I hope some other board members will have thoughts on this.
Dr. Chan?
This does look very, as a wide scan of the issue, different pieces of the issue. So one comment might be to consider what are the real risks of overprescribing, legal, license, and to talk about it directly, not around the peripheral. Just talk about what happens if you do this. Because that's what we see with our disciplinary cases. What happens when you overprescribe or you do it deliberately. So that may be another piece of the puzzle to put in there. I'll have to listen tomorrow for that discussion on pediatrics. But when we look at things like side effects, what are the symptoms of it, in pediatrics, when you see a lot of kids that have behavioral issues, the more often you see it, the more you know you can identify what you're looking at. So sometimes when we get the referrals, it's the misinterpretation from maybe a general dentist that doesn't see enough of them to interpret really what they're seeing. So what I'm asking is maybe to have a consideration for the misinterpretation of signs and symptoms of addiction in a pediatric population.
So if I get it right, through the chair, you're suggesting both sort of a medical legal discussion and also one specifically related to pediatrics.
Yvette, did you have, I missed a hand maybe, are you okay? All right. And we certainly have the model out there that the CDA has been promoting with Dr. Parks and Bundy, which has been an excellent course over the last, 4 years, I believe. And so the physician and the pharmacist, speaking from both ends of their spectrums, really brings a lot of issues to bear, and it hits the point directly in so many areas but I would agree with your comment, Steve, in terms of a better understanding of just the addiction process would be helpful to have in this course, because who do our patients come to? Our patients go to the people that they trust. First, their parents, and their pastors or their priests, and their physician and their dentist. And if we don't have answers for them, we're not going to be the resource that we have the potential to be. So this course, this educational course, will give us as a profession resources that we can employ to save lives and help those folks that are desperately needing for solutions and don't know where to look. So I think all of these comments are good. It's a beginning conversation. Our staff has asked for it. So anybody else have anything? Yeah, Dr.
One
Chen.
more question, and this is just conceptual. There are a lot of different topics here. Is there a model where you could have maybe 2 or 3 different tracks taking different pieces of this, and then the first renewal period you take track 1, second period you take track 2, and then track 3? You're not repeating it, but you're looking at different textures. Is that a model?
Those are all possibilities. I mean, there are quite extensive offerings that take multiple sections to complete, but I was just trying to give us something maybe modeled along the current required courses that we have that would be a little more.
And the argument, if you go too superficial, it may not stick.
Well, that's something we have to decide. Yeah.
What I'm hearing the committee is agreeing upon, first off, SB 1109 only adds this language to our continuing education, the ability to put this in our continuing education regs. It doesn't make it mandatory. So it's sounding like the committee wants to recommend the board have mandatory continuing education. Is that correct?
That would be my intent.
That seems to be the trend.
Well,
I
that
mean,
would
yeah.
need to be the recommendation coming from the committee,
Okay.
that
Mhm.
first off, you're looking at mandatory education. The number of units, as Dr. Witcher threw out, the 2 units, is fine, but I think that you also have to have further discussion about what part of this crisis do you feel is going to, does the board want to focus on? Following Dr. Chan's comment about the particular elements in the Florida continuing education being broken out, what would the licensees receive best? Are we talking about the ability to be a resource to their patients? Are we talking about what's available within the community to guide patients to if they recognize addiction? And then I guess the first one would have been recognizing addiction. So I mean, I think it's up to the committee to talk about the elements of what you would want this mandatory education to consist of. The specifics don't necessarily have to be there yet, but I think in discussing it and asking the board to make it mandatory, you need to have some sort of an idea of what you're hoping to accomplish by having this mandatory education. As Dr. Witcher said, after a certain period of time, we found the Dental Practice Act is a requirement, yet many people don't. We get the story. I didn't know that it was in the Practice Act. So whatever the committee recommends and the board moves forward with, we should make sure has the most impact. I would recommend.
Oh, one other thing I'd like to mention is a lot of states require this only for dentists who have a DEA permit. Now there's DEA permits and DEA permits depending on whether you elect for Schedule 2 or not. And I don't know that we have the capability of separating out our licensing population by who has DEA permits and who doesn't. I don't think we can do that. So that might not be a viable approach here. But I thought that was kind of interesting because a lot of dentists tell me, well, I never prescribed narcotics or Schedule 2. Why should I have to do this? Well, I mean, there's a general education perspective, and it is a big issue. But, they have a point. So, I don't know. It's just something to consider. And I have an interesting article that came out of University of Florida a couple of years ago where they actually surveyed dentists and their attitudes about prescribing and, this particular problem. And it might help us kind of target, our educational effort a little bit more. So I'll share that with you later.
Dr. Chan?
Can I just ask for a point of information and it has to do with the CE and probably integrating something about the cures requirement. But the point of inquiry is what happens if you haven't signed up for cures and you still prescribed? What happens? What are the sanctions for that? Carlos, maybe?
Well, it's a violation of the Dental Practice Act, so you could receive discipline.
Yvette?
Karen, you really just brought up some questions that made me think about, mandatory requirement, RCEs. Sometimes if we do go there, we're on a slippery slope with other regs as well. So I would like to, bring this back to committee, and so that we can begin to think about those questions.
Thank you. Meredith?
Yeah, I just also wanted to kind of at least partially address what Karen brought up. And, I think I'm certainly supportive of making it a requirement in the subject matter, whether it's, 2 hours of renewal period. I do think it should continue because, I don't know, 10 years from now, are you really going to remember something you took? So I think repeating is not a problem. That being said, though, I think because of that, we want to be careful about. It's raining. We want to be careful about making it too specific and saying it needs to cover X, Y, and Z. So I think what's better is, like you started with the list here, saying it, it needs to cover at least one of these topics. So that way you could take an hour on topic A, an hour on topic B this year, or something else as you go forward. So it might not address one particular issue in the next 2 years, but I think it's more useful over time, and also just a little bit more practical on how you can actually manage it. And people, I think, are unlikely to take the exact same subject every time because, it gets a little boring. So I think people will inherently want to, if they have to take something on, opioids, and they already took subject A, they're probably going to look for a different one rather than the exact same one that they took, 2 years ago.
I mean, if I may, through, looking at this, they make a big point about taking a universal precautions type approach to using a PDMP. In other words, you don't really know who's the problem and who isn't. And I think some CE the same principle might apply to that. In other words, maybe you have to require it in order to reach the people who might not think it's a problem when it really is. So, just a thought.
So in your continued discussion of this, if you have some ideas you'd like to throw out today as to what types of things you would like to see as a possibility for continuing education, or what other information would you like the staff to collect and bring back to a future meeting? I don't want to let the discussion just stop here, because this is the working group, and so if you could just sort of turn the switch to say, let's brainstorm for a few minutes and give us some additional ideas about where you might want to go. And you may look at the Florida list. Is there something that jumps out now? And we'll continue to look at other states and see what other things are out there, bring that back to a future meeting. But if you wouldn't mind, at least for a few minutes, just kind of throwing things out, we'll have staff record these ideas. As I mentioned, are we anticipating that this course is going to first perhaps educate dentists in recognizing addiction? Is it going to be the risks of prescribing, as Dr. Chan had said? Is it going to include, assistance for licensees in not only recognizing the addiction, but then the resources that would be available within the community to help that particular patient? And those are my suggestions, and I hope you have more.
Tom? Just, if I can ask through the chair, Karen, from the time we do our homework on this and bring it back again, because it has to be publicly noticed again, and by the time we get the language written and actually implement this, the progress of this issue continues, deaths continues, injuries continue, because we haven't acted on it. And then we have new entrants into the licensing pool that haven't heard this yet. So we're potentially not meeting that group too, in terms of telling them this is a problem. Is it, and I'm not here to rush it through, but this is growing from the time I came on the board when Tom started talking about it. I'm concerned.
I appreciate those comments, Steve. Let me respond a little bit in that, in that when people in my generation learned pain management, it was probably from the oral surgery department in dental school, and maybe another department, a little bit from here, a little bit from there. Today, we live in a different world, and the dental schools are honed in. They're recognizing the importance of this issue, and pain management is becoming something that the new younger generation is getting a good course in. So don't despair. Some of us older types may need a little bit more help than some of the younger kids getting out of school, because that's changing and evolving in our educational system. Let me tell you just a little bit about what Pennsylvania does just to give some example of what we're going to be finding out when we go back and do our work. All prescribers in Pennsylvania applying for initial licensure complete at least 4 hours of board-approved education consisting of 2 hours in pain management or the identification of addiction and 2 hours in the practices of prescribing or dispensing of opioids. To renew a license to practice in Pennsylvania or a restricted faculty license for the next renewal period, the requirement is that all dentists complete at least 2 hours of CE in pain management, the identification of addiction, or in the practices of prescribing or dispensing of opioids. So there are there's great resources out there. I don't think we'll have trouble. Maybe our difficulty will be to decide what's most pertinent to California in today and where we are in this crisis. Karen was talking about do we broaden it so that we become a better resource for our patients? I think there's a role for the board to play in that. I think there's a role for CDA to play in that, which would be different than our role. But because we are a trusted entity, our patients will come to us and they will share their most difficult situations, whether it be with a child, a family member, or someone who's struggling. And I think it would behoove us to have a better understanding. Each of our communities are different, but all those communities have resources. It might be mental health. It might be, different collaborations of folks interested in this topic. But there are faith-based programs. There are different places where you can go and get help. But these people, our patients, don't know where to go, so they turn to us. And if we can have more enlightenment in terms of being able to answer some of those questions and point them in a solid direction, I think that would behoove us to be more aware of what's going on in our individual communities. Off my soapbox.
It's just that the marketplace is crying out, do something.
And we're doing something. We're gathering information. Our staff is hearing this information. We're going to be hearing from the public very shortly. We're going to include those comments and those remarks. And yes, we are doing something.
To make a specific suggestion, I mean, is everybody okay with a 2-hour required course? I mean, this is just an initial kind of, well, we can't do straw votes, but yeah.
Yeah, I think my thought is 2 hours seems fine. I don't know if it has to be 1 2-hour course or just 2 hours in the renewal period, right?
Well,
because you could break it up and have 2 different 1-hour topics. So I just, once again, I don't know if you need to make it a specific.
I'm just modeling it off the courses we have now. And what I might suggest is you had some ideas for content, send that to staff. Maybe people go through and mark it up, come back to the next meeting, and then maybe we can kind of package it. And drafting the regulatory language, I mean, we can just use an existing section out of, 1005, I think is the CE regs, and model this done. I'm sorry?
1005 is infection control.
Oh, okay. Required.
Close.
Does that require a motion, or
It's the pleasure of the chair.
it does? Okay, let's take that as a motion.
Okay.
I'll second that. You want to explain, Spencer, what the options are?
What I would recommend is that, since to the committee members would be, or at least the committee members would be submitting some recommendations, I would think that the public would also want to weigh in on this, and you might want to also solicit information from them so they can send it into CARE.
Excellent. Can we do that now? Can we open up to the public now? Is it appropriate?
Sure.
Okay, it's now open for public discussion. See Dr. Felsenfeld.
Is this on? Yes, good morning or good evening. Alan Felsenfeld, the California Dental Association. We came here to make a couple of comments to you, and I've been listening to the discussion you've had. It's been very good because you've stolen almost everything I'm going to say, but I would like to reiterate a few things. As you are all well aware, the California Dental Association has been particularly proactive in the education of its members on the opioid crisis for many years now. We started things a number of years ago, and Dr. Stewart was involved in that as well. And we have done a number of educational programs. We've had twice a year, we do a course up at CDA Presents, either in the north or the south, with Dr. Parks and Dr. Bundy, and that's been very well attended. We've had a California Dental Association journal specifically dedicated to substance abuse and opioid crisis. We've had a special issue of the Update specifically dedicated to the crisis, and we've had another publication that's going to be coming out presumably next March, and it's going to be on the same topic. We have ongoing courses as well. What's more, our House just recently, we just finished our House a couple of weeks ago, and we adopted an opioid policy, which is consistent with the types of things that we've been looking at. So we're looking forward to more. We support contemporary approaches to managing the crisis. We have some anecdotal evidence that maybe as dentists, we're not doing so badly. We are writing fewer prescriptions. It doesn't minimize the crisis that much, but there is some evidence starting to come through. But we support commonly looking at this in the future and helping with, in terms of your topics, how do you identify the patient who is a substance abuser, and how do you deal with that patient? It gets complicated from time to time. Those of us in surgery understand that certainly. Finally, if you're going to go the way of a mandatory course, Dr. Witcher stated it very well, we feel that a mandatory course should be there, and mandatory maybe only as long as the problem exists. And if in fact we can see that the crisis is diminishing on the dental side, it may be something that you would consider sunsetting at some point, not during sunset review specifically, but not doing it, and reevaluate it. We offer our help. We certainly have done a number of different programs, and as you develop your programs, we will be very happy to help you in any way that we can.
Thank you, Dr. Felsenfeld. Further, Bruce.
Yeah, in thinking, Dr. Felsenfeld's comments reminded me of something that in the report we just had, they talked about how MedBoard has substituted an existing requirement for a new one. In other words, you can do end-of-life counseling or you can do prescription management. So, maybe that would be an approach if all of a sudden we decide this isn't as big a problem, put in another required course that's optional as a substitute. I mean, just a thought.
Further public comment? Spencer.
Following up on that comment, I mean, I wouldn't put off promulgating the regulations because we're not sure how long we want it to go. Because at any point in time, you may have a different set of circumstances and different board members that want to change up the regs. So I think keep that in mind, and that may help expedite what Dr. Chan's concerned about is all the answers don't need to be provided to get this process started. And once the language is adopted, that doesn't mean that you don't stay on top of this issue on a regular basis and come back and adjust appropriately.
Then I think it's appropriate to, if the subcommittee will agree with me, that the committee today will take no action, but that we will be sending our comments to the staff with the understanding that we will be as helpful as we can be while we're putting together the content to discuss at a future meeting. Yes, and any stakeholder that has information that they'd like to provide, it would be appropriate to refer that to our executive officer, Ms. Karen Fisher, and we would be most appreciative of that effort as well. Okay, I think, see no further comment? Oh, let's see, we're back on the agenda. Public comments on the item not on the agenda? Seeing none. Future agenda items? Committee member comments on the items not on the agenda? Seeing none, this committee is adjourned. Thank you. Thank you, committee.
All right, board members can come back up to the dais. Number 6. Okay, we're returning to the full board open session, and before we get to item number 6, Dental Assisting Council meeting report, Ms. Fisher would like to make an announcement. So I just wanted to recognize Nick Sukamaki was our DAG liaison, and he was reassigned in July. And just recently, Linda Schneider reassigned a DAG liaison to the board. And if Daniel, you would stand. Daniel McGee is our new DAG liaison. You'll have an opportunity to hear more about his background when, when we go into closed session in a few minutes. But he will be, he's visiting us for the first time. And I wanted to make the introduction to the public, stakeholders, board members, and staff. Welcome, Daniel, and we'll be starting our closed session in a bit.
Thank you, Karen. Thank you. All right, we're now on item number 6, Dental Assisting Council meeting report.
Okay, as council chair, acting council chair, I'll give that report. So the Dental Assisting Council meeting of November 29th, 2018 was called to order. Roll was called. Quorum was established. We approved the meeting minutes of August 23rd. We received informational items, including an update on dental assisting program, course applications, and RDA program evaluations. The reevaluations are interesting in that there is a new, relatively new requirement that RDA programs need to be reevaluated, or all dental assisting programs need to be reevaluated every 7 years. This was started by selecting 50 programs. Process is continuing. It takes on the average of 60 to 90 days. 5 programs have completed the process to date. We also received an update on dental assisting exam statistics and noted that the combined pass rate for the RDA exam was 54%. The dental assisting RDA EF clinical and practical exams, the overall pass was 69%. The general written RDA EF was 64%. We also received an update on dental assisting licensing statistics that we do at each meeting. I'll refer you to your meeting materials for the details. Coming up next was one of our action items. Item number 6, discussion and possible action regarding the use of an alternative examination resource to administer the RDA and extended functions clinical and practical exams. And the background is that there are expanding number of programs, there's more graduates, and increasing difficulty recruiting examiners to do the RDA EF clinical and practical exams, plus difficulty finding examination locations, because these have to be done in dental schools. And basically the staff was concerned that because of this difficulty that we should look at examination alternatives. And so the council is forwarding to you a recommendation to direct staff to work with the Office of Professional Examination Services to research potential alternative examination resources to administer the RDA EF clinical and practical examinations for licensure in California. So it's up to the board to accept, modify, or reject that recommendation. Do you want to take this item up, or do you want to do them all at the end and vote on them? Okay, so I will ask the board to consider this recommendation from the Dental Assisting Council regarding RDA EF potential examination resource alternatives. And this is a direction to staff to work with OPES to develop those.
I would move the recommendation. Burton.
Second, Olagi.
I have one question. Were they supposed to be in our binders? I don't have section 6 in my binder. I don't have it in my binder.
Under DAC?
The items were under the DAC agenda and meeting materials. It all should be in there. Am I off on the numbers? It's entirely possible.
Number 6.
You don't have anything under DAC 6?
So we're just going to look at the DAC report then, the DAC agenda.
DAC agenda. Do you have DAC 6?
No, it's DAC number 6, yeah.
Should be there.
But not the actual agenda item, or we're just reviewing all of them going one by one?
We're going to go individually.
Okay. Thank you. Yeah.
Does anybody have questions about the recommendation? Because maybe I could elaborate and just fill you in.
Bruce, when I heard you talking, you mentioned just I think you went over the RDA pass failure rate. You discussed that in your committee?
Well, actually, it was reported to us, but that item was not agendized for discussion, so we couldn't actually discuss it. And we may bring that back as a future agenda item. I'll get to that.
Okay, then I'll wait until you get to that.
Thank you. So is everybody clear on the recommendation from the DAC?
No, I'm sorry. Would you go ahead and, because we're...
Yeah, sure. Board staff is concerned that the administration of the RDA EF examination is becoming increasingly difficult to sustain due to the limited pool of examiners, increasing number of board-approved RDA EF programs, increasing sites for increasing cost of rental site, and limited locations to offer the exam. So staff requested that the DAC recommend to the board that we direct staff to work with OPES to research potential alternative examination resources to administer the RDA EF clinical and practical exams for licensure in California.
Thank you.
So I guess we're looking for a motion to move
We had a motion.
Oh, I'm sorry, yeah,
And we had a second.
okay. So I think, public comment?
You can call for it, you're leading the discussion, so you.
Okay, so we already took public, do we need to take public comment again? Okay.
No.
Coming out of committee, we're good. Okay, so go ahead and take the roll, Jerry, if you would. Or, I'm sorry, who's taking the roll on this week? Yvette? Okay, sorry. Got to put the other hat on here.
Okay, but, well, I'll need to get the motion from you. No, you don't have to say it.
I can send it to you. Yeah.
Please send it to us. Okay, Burton? Yes. Jan?
Yes.
Schipelinger, yes. Lai?
Yes.
Lai, yes. Larry?
Yes.
Larry, yes. Lay?
Yes.
Lay, yes. McKenzie?
Yes.
McKenzie, yes. Medina?
Yes.
Medina, yes. Morrow?
Yes.
Morrow, yes. Alagi?
Yes.
Alagi, yes. Pacheco?
Yes.
Pacheco, yes. Stewart?
Yes.
Stewart, yes. Witcher?
Yes.
Yes, Witcher. You?
Yes.
You, yes. Motion passes.
Thank you. Okay, our next action item also was discussion and number 7, discussion and possible action regarding development of a legislative proposal relating to requirements for certification in coronal polish and pit and fissure sealants in the RDA profession. Again, this was a staff item brought forward to us. There was concern that particularly our DAs, which do not hold a license, were taking courses in coronal polish and pit and fissure sealants, were going out into the workplace, and some of their employers were interpreting their possession of the certificate as their authority to do those tasks, when in fact they cannot do it unless they are RDA. They have received an RDA license, and basically they need to take the written exam. So the council considered this. The council wanted things left the way they are, and the concern was that taking the certification courses for those 2 items out of the programs would require additional expense to the applicants and would not necessarily serve any purpose. And also although we had anecdotal information that this was a problem, there weren't any complaints or anything. So I think we need to monitor this, but basically the council's motion and recommendation to the board was to reject staff's request to develop legislation regarding the requirements for certification in coronal polish and pit and fissure sealants for the RDA profession. So that is the council's recommendation, was to reject that staff request. So I'll need a motion to accept it or reject it, I guess.
So I just want to people look a little confused. So the DAC agenda items are always in the full board packet, and it's expected that board members are going to read these agenda items as if they were going to be voting on them, because essentially you are now voting on this. Most of you were in the room while this discussion was going on. So Dr. Witcher brought forth the committee's recommendation to reject the staff's recommendation. You don't necessarily have to accept that. You can do a number of other things. You could say you'd like to see more study, you'd like more information. You know, you don't necessarily have to accept what the Dental Assisting Council recommended. And in this case, they wanted to keep the status quo, and they did not want to move forward with the staff recommendation regarding coronal polish and pit and fissure sealants, and that they should be required after licensure. So hopefully you all got a chance to look at that item, and if you had questions while you were reviewing it, now would be the time to bring up those questions.
I tried to give a synopsis of the discussion. I can repeat that if anybody's interested. It gets a little technical, as most things do related to dental assisting, but I can, Rosa can help me. And
Bruce, I'd like to hear your take on taking those courses during their course. Certainly makes sense, but then what's the argument for waiting until after they graduate and then taking the course? What does that benefit? Who does that benefit, and why?
Well, currently the way it works is you have to complete Pitt and Fisher sealants, that certificate course, within the time prior to your first renewal. So you can take that after graduation. Coronal polish is usually given within the programs. However, the workplace experience pathway DA who does not go through a formal program would not have the opportunity and would have to take the standalone course. So the question is, some of them may not complete their licensure requirements and take the written exam. In order to take the course, they have to fulfill all the requirements for licensure short of taking the exam. So this just ensures that they take the written, get their license prior to taking coronal polish, so there's no doubt that they're licensed. It's a subtle thing, but like I say, this came up, and the issue was, are people basically doing coronal polish in an unlicensed manner, and again, the people coming out of the programs, they're all getting it in the programs, not an issue for them. So it's, there was a sentiment among the council that it was sort of not necessary to punish the many for the sins of the few, and that the dentist's responsibility, they were responsible to know what licenses and certificates their staff had, and that this was largely an enforcement issue. So,
And just to clarify a little further, and Sarah, correct me if I'm wrong, it had more to do with the coronal polishing segment of this. Essentially, before RDAs are licensed, they do have the ability to go get the coronal polish certificate. And there was some concern that some dentists may not realize that an unregistered dental assistant could accidentally perhaps be doing coronal polish. So they can get the coronal polish certificate before they actually get the license. And we just wanted to clarify somehow that they wouldn't be actually expected to do this duty or do this duty until they were licensed. Is everybody following that discussion? Pitt and Fisher has always existed to take after you're licensed, or Sarah saying,
Sorry.
stop?
No, so I'll separate it out. So coronal polishing is required for RDA licensure the application. So that course has to be completed as part of the RDA educational program or part of the standalone course for those that are qualifying through on-the-job training. So they have to present their certificate of completion as part of their application package to the board to submit to sit for their written examination and become licensed as an RDA. And so board staff had heard stories. Again, we don't have any complaint evidence data to support this, but there's stories that these unlicensed dental assistants, which is what they are as they're going through the educational process to get the requirements met to become a licensed RDA, they're completing their coronal polishing course and getting that certificate of completion, and their dentists are then allowing them to perform coronal polish as an unlicensed dental assistant, which is unlicensed practice of registered dental assisting. So that was the concern. So staff had suggested modeling it after the Pitt and Fisher sealant course. Pitt and Fisher sealant course is required as part of the RDA educational program to be completed. So those that are qualifying for RDA licensure via education complete the Pitt and Fisher sealant course when they're licensed. It's marked on their license. Those that are going through OJT have the option of waiting to take the Pitt and Fisher sealant course until after they're licensed, at which time they're required to complete that course, but only upon their first renewal cycle requiring continuing education. So staff had brought it up as a potential unlicensed activity issue. The council had made the recommendation that it was more of an enforcement action issue and more of a dentist supervision issue, and not something that we had the data behind to make any changes legislatively at this time.
Dr. Lay.
It seems really interesting to me that we've been requiring the RDAs, the dentists, to take 2 hours of Dental Practice Act every 2 years for our renewal. And for some reason, both categories are still confused. The dentists still don't know what an RDA scope of duties should be. And the RDAs are confused whether or not they can actually do something that they're not allowed to do before they actually have their RDA license. So I just don't understand why this is an issue. I think it should go into enforcement, because really, if they're required to take these courses, and if they don't learn anything during the years of taking the courses, then they need to pay attention, and that should go into enforcement. And I don't think that the staff should really spend any more time on doing something that's not really necessary, because it's already there. You already have safeguards, and why are we trying to do something or fix something that really doesn't need to be fixed? Okay, the fix is really to discipline, is to really provide disciplinary actions, because everybody should be aware of what the duties are. We are required to post the duties of auxiliaries in our office. And if you don't do that, you don't look at that, then you know what? You need to pay. You know, that's all there is to it. So I do think that it's really a non-issue. Yes, it is an issue to some people, and there are people out there that are doing it. They're doing it wrong, and if they get caught, then we need to really, go into enforcement. The laws are there, and if they're not paying attention, it should not be our problem.
Yes.
As I listened to this discussion during the committee, my sentiment was the same, that this is not an issue. There is a way to do enforcement on it, but it's not an issue that should rise to the level of actually making some formal statement about it. And so having said that, I would like to move the DAC's recommendation that we reject staff recommendation. Burton.
Second. Aye.
I saw Abigail.
Yeah, it was just gonna, basically, just to make sure that we understood, it was, the DAC's recommendation was to reject, and thank you for
Correct.
clarifying that, yes.
Okay. Further discussion, and I guess I have a comment. If we're concerned about our dentists, if we're talking about enforcement, maybe we should step back just a little bit and try to do a little bit better job in communicating the responsibility that the dentist has in this arena, either on our website or however we can get the attention of the dental community. But maybe what we need to do as a board is to do a little bit better job communicating this issue with whatever means we have at our disposal to make sure that our dental colleagues are aware of the importance of this issue. And I think I'd rather be talking about that than enforcement until we give that a chance. And, if we find in a few months that it's not improving, but we put a star on our website and we've drawn attention to the problem, can we start there?
Okay. I think all of these duties are on the website, and we are required to have postings on duties of auxiliaries in our office. It's there, and if we attend these courses every 2 years, and if you pay attention and you actually take these courses, then you will be doing the right things. For those who don't do the right things, education is not going to do anything, because they have been educated. And I don't mean to be hardliner on this one, but I think that we've been talking about this year after year, and we implemented this mandatory course for almost 2 decades now, and we still see people saying, I didn't know that. Then I don't know what more education we need to provide. If people are not listening, they're not going to listen. If they don't change behavior, they're not going to change behavior. And I think it gets to that point. And, it's on the website. The posters are required to be posted. The courses are mandate. What else do we need to do? I don't know.
Yeah, I'm just curious about the dental assistant programs that offer an externship. You need to have an externship. They need to go to your office, and these schools are saying that they're allowed to do polishes while they're not RDAs. Is that correct? I just want to see what's going to happen with that.
That the externs are
The externs, the school says, and they sign a paper that says that they can do polishes while they're doing their externship.
I'll defer to Karen or Sarah on that one.
It's part of their educational curriculum.
So how
Part
does
of
that
the,
affect?
part of the didactic laboratory or the preclinical and clinical experiences. This wouldn't have anything to do, if the council had recommended that we do a legislative change, then it would have removed the coronal polish and the Pitt and Fisher sealant courses from the curriculum of the RDA programs, which would eliminate that. But
It
what
would
they're
eliminate
recommending that we just leave it, it's fine. We leave it the same. There would be
okay
no
to do it
change.
like that?
Yes,
I mean, they
it's part of
get
their
coronal
educational.
polishes, and it's part of the educational, and the dentist is not liable for? is
Well, the dentist
liable?
supervises them, but
Supervise,
it's
yes.
part of their educational
Okay, so that's what.
program.
I just want to make sure, because that's what's being said out there, that you can do it without being an RDA for all polishing.
I'm asking Spencer for a little clarification.
Ms. Laren, if you would like this issue placed on the agenda, on a future agenda, for
Well, I
full
just
discussion, that's fine.
No. I just wanted to find out if this has anything to do with it. Is that going to affect it in any way?
This is a separate issue from the
It is.
extramural facilities.
And I correct myself, sorry for calling you Ms. Dr.
Senorita.
Laren.
Senorita.
Thank you, Sarah.
But thank you, that was a good clarifying thing for me to understand the difference. Thank you for bringing that up.
I think you're leaving this discussion for.
Well, I think we're ready to vote.
Yes. Public comment? Do we-
I think
well, we
coming
don't.
out of committee, I think we've decided to leave. So, call the roll.
No, it's coming out of committee.
Oh, okay. All right. Burton?
Yes.
Chan? Yes. Chappelle Ingram, yes. Lai?
Yes.
Lai, yes. Laren?
Yes.
Laren, yes. Lay?
Yes.
Lay, yes. McKenzie?
Yes.
McKenzie, yes. Medina?
Yes.
Medina, yes. Morrow?
Yes.
Morrow, yes. Alagi?
No.
Alagi, no. Pacheco?
Yes.
Pacheco, yes. Stewart?
Yes.
Stewart, yes. Witcher?
Yes.
Witcher, yes. You?
Yes.
You, yes. Motion passes.
Okay, moving along, number 8. This was another action item. It was requested by the Foundation for Allied Dental Education. And again, this was a request for addition of statutory provisions. This is related to the use of materials and devices authorized for use in performance of the RDA EF scope of practice. So, the foundation submitted draft language, so their request was quite specific. Basically, the language is in your packet, but basically, it would allow, if this was placed into statute, an RDA EF would be allowed to use any material or device approved for the use and performance of a service or procedure within his or her scope of practice under the appropriate level of supervision, if he or she has appropriate education or training. So that was the proposal, and just bear with me here. That one, there were 2 parts. That was part A, and as I recall, that one, the council moved, seconded, and passed to refer this proposal to staff for further study to bring this back to a future council meeting. So basically, that does not require action on your part.
No.
The materials and devices was recommended to be forwarded to the board for consideration. And B.
Oh, I'm sorry. I'm sorry.
Proposal B relating to continuing enrollment until giving the option of maintaining enrollment until becoming licensed and then graduating was recommended for further research to come back to the council.
Okay, I beg your pardon on that. I had those reversed. The council did recommend that this proposal should be sent to the board for full board for consideration. So that was proposal A, which is statutory provisions relating to the use of materials and devices authorized for use in the performance of RDA scope of practice. The idea here was the dental assisting profession, RDA EFs in particular, are hampered by the fact that they don't have the statutory authority to do a lot of the newer duties that they're being asked to perform. The dental assisting laws are very restrictive. This would open them up, but they would still need to be clarified in regulation. For instance, what an approved material or device was, what the training and education would need to be. So again, the language might seem a little broad, but it has to be, implemented and made specific through regulation. So this is for your consideration only. You can accept, modify, or reject it as you see fit. Yeah, let's take Part A, because they're really very different. I mean, they're both statutory proposals, but they're kind of unrelated, so.
Well, Part B is staying in the DAC.
Yeah, correct.
Okay.
Part B is not being brought forward. We asked staff to do further research. That's what I get for trying to trust my memory over what I have written.
We're here to help. That's why we're here to help. So really, we're not breaking out any issue. We're looking at the language under A.
Correct. And this is a request to move forward with a statutory change. So, we'd need to find a place to do that, a vehicle for it. I don't think it would be an item for sunset review. It'd be something we would add to our long list of statutory changes that we would like to see.
I wasn't clear about that part, whether FADE was looking for us to do that, or whether they were asking for permission to go forward with this themselves. I'm not too sure about that part.
This item was referred to the council for consideration. The council made the recommendation to the board to take it up. So it came through the council to you.
But further, who would do it? So it's approved, so who's going to do it? Is the board going to do it, or is FADE going to do it?
I think the request was for the board to do it.
Okay.
And that makes sense, because the board would have to have the authority to do this in order then to move forward with regulations that would clarify the specific things in this piece, the devices, the education.
I see public comment, please.
Thank you. LaDonna Drury-Klein, Foundation for Allied Dental Education. We were contacted by the board, as other stakeholders were, with respect to input on potential statutory change during the sunset review process. As you know, the foundation's been involved in that process for the last 12 years, and this was certainly an opportunity to bring back perhaps some issues in inconsistencies between statute and regulation that were identified during the 2016 process. So we did respond to the board's request for input for consideration of statutory amendments during this upcoming process. These were two of the sort of low-hanging fruit items that we identified as a potential problem, where there has been discussion with respect to, for example, the cord pack procedure for the board in order to be able to change that procedure in terms of the actual material used during the testing process. You would have to have a statutory amendment to allow for something other than cord. And so what we are trying to do in this process is to not have a repeat of what happened during the practical exam, whereby the board takes action and then has to go back and get emergency statutory language in order for that position by the board to be effective. In other words, when you eliminated the practical exam, you couldn't issue RDA licenses anymore until such time as you had the statutory authority to do so. what we are trying to do is be proactive and say that we recognize that cord specifically as a prescribed procedural material during the EF examination is an antiquated process. And in order for the board to say tissue management, utilizing whatever other material you deem necessary during that exam process, you do not have the statutory authority to do. So what we did was we took existing statutory language that was already in place and put into place in the 1900s for the hygiene bill and exactly duplicated that same language so that it's already in precedent, it's already consistent. It allows then for the board or the DAC in any future considerations of materials and devices that we might use in our scope of practice to be able to be broadened, and also gives the board the authority then to introduce any other materials or devices during that testing process. So yes, it is something that we are asking the board to take action on, and that we would like the board to bring forward during the sunset review process as a part of what we hope will be a removal of cord specifically as the device for tissue management during our examinations.
I need some clarification because I was the board's counsel at the time. My recollection is that the legislation allowed the board to place a one-year moratorium on this, on the requirement that relate to the practical examination. In that, after such time, then the board could begin to issue licenses again without.
I was going to comment on this too. I don't think Mr. Klein intended for us to be looking at the specific issue of what happened when we took the practical exam. What I think the point she was trying to make is you have to have statutory authority before you can have a regulation. And so that was kind of a confusing issue to bring up, because I would say that that particular issue was an isolated incident, and staff typically tries to make sure that doesn't happen. But I think what she's trying to bring home is what she's recommending the board pursue is statutory authority to have more flexibility in determining what the EF exam is going to look like in the future. I believe staff does not see a downside with the board taking this on. Now, whether or not it will actually be considered within sunset review, we'll have to see, because we've already submitted our report, and we'll see whether or not this gets in there. But whether or not it does get in sunset review doesn't mean that we wouldn't take it up the following year. I think at some point the Legislative Oversight Committee will say, great, we may agree with this, but why don't you put it in a piece of legislation moving forward?
And, pardon me, but perhaps the analogy used was not necessarily the pinpoint issue, but rather a more current occurrence of where board action or regulatory action takes place preceding the ability to have the statute in order to have the authority to do so. We are trying to, again, be more proactive in this next round of sunset and make sure that we do not have inconsistencies, so that anything that we bring forward in the upcoming comprehensive dental assisting regulatory package does not fly in the face of existing statute.
Yeah, before we go any further, thank you, LaDonna. Dr. Lay.
Aye. That's late.
Dr. Lai.
That's not good. Anyway, I'm just looking at, if we were looking at new materials and devices, are we then including laser, chemical medicaments for retraction, ICAT usage?
That would be a discussion that would take place during the regulatory process. But it would give you this statutory change would give you the option to discuss those things. Right now, you don't have the option to discuss.
But within the scope of practice of an RDA, yeah.
Right. It's not intended to expand the scope of practice. It's intended to give the board a broader authority.
Flexibility with changing technology and moving forward being able to incorporate additional materials and devices that may come as a result of the future, but still within the scope of practice of the EF.
But it would be a statute change.
This would require statutory change.
Thank you.
Nice to see the public. Dr. Atchison, welcome.
Thank you, Dr. Is this on? I'm Dr. Guy Atchison, California Academy of General Dentistry. Two comments. One, we're about education and moving forward and being contemporaneous. So the idea of liberating tissue management in preparation for, say, master impressions beyond cord is wonderful, and we support that. But we have a bright line on what a non-dentist should be able to do in surgical irreversible procedures using an electrosurge or a laser for tissue management in this procedure would be something that we would not be in favor of and would not advocate including in an increased scope of practice for dental assistants or RDAs or RDAEFs. Thank you.
Thank you.
I am going to call for a motion, and I would like a motion that we move forward on this. Burton?
Bolagi, second.
Madam Secretary, I guess I should have said that we accept the DAC's recommendation.
Oh, no.
Very good.
Okay, I'm going to say it again. That we accept Fade's proposal that the DAC, okay, that was forwarded to us. Okay, Burton. Let me just say Burton.
Okay. There's a motion by Burton and seconded by Alani. Yes. Okay. Burton.
Aye.
Chan. No. Chan, no. Chappelle Ingram. Yes. Lai.
No.
Lai, no. Laren.
Yes.
Laren, yes. Lay.
No.
Lay, no. McKenzie.
Yes.
McKenzie, yes. Medina.
Yes.
Medina, yes. Morrow.
Yes.
Morrow, yes. Alagi.
Yes.
Alagi, yes. Pacheco.
No.
Pacheco, no. Stewart.
Yes.
Stewart, yes. Witcher.
Yes.
Witcher, yes. You.
No.
You, no. Motion passes.
Okay, just by point of clarification, Fade did bring forward a second proposed amendment. That was to B&P Code 1752.1. This was to allow RDA and RDEF programs the ability to keep students enrolled until they successfully complete the licensure exam. That was forwarded to staff for further study, and we'll bring this information back to a future council meeting, so you don't need to consider that. Now, moving along, item number 9. This was the discussion and possible action regarding scope of practice for the RDA EF2 as submitted by Joan Greenfield, representative of the RDA EF Association. And this was the proposal for the addition of the administration of local anesthesia and administration of nitrous oxide as allowable duties for the RDEAF2. And we heard testimony related to this proposal at our last meeting, and we heard additional testimony both from its proponent and from public members and the profession. There was extensive comment in support of this, and there was extensive written testimony in opposition. And after much discussion among DAC members, we asked OPES to look at this, and they came back with some recommendations that are included in your board packet. And subsequent to that, it was moved second in the past to direct staff to conduct more in-depth surveys of both dentists and a larger sample of RDA-EFs to assess their opinions on adding the administration of local anesthesia and nitrous oxide to the RDEF scope of practice. And this will come back to the council again. We just didn't feel we had the information necessary to make a recommendation to the board. I know it seems like we're delaying this, but there was quite a bit of testimony on behalf of the proponent. OPES had some recommendations and made specific recommendations as to how we should move forward with this. So basically, the council took OPES recommendations on that item. Now, there was a subsequent item that was part of the OPES recommendations that the council recommended be referred to the board. And that was OPES suggestion that the board explore the possibility of eliminating multiple layers of RDA-EF certification and incorporating them under one license. So the council wanted the board to take that up and explore that possibility. In other words, the way it works now is we have RDA-EF1s that have lesser qualifications and were licensed prior to January 1, 2010. And we have RDA-EF2s that were trained that have much more expanded scope after the date of January of 2010. And now there's another proposal to add yet further scope expansion. And there was concern about the efficiency in administering exams, administering permits, when you have multiple certificates overlying a particular licensing category. And again, there's strong feelings on both sides. Obviously, some people think we have a lot of certificates and that's okay. Others feel it should all be rationalized and put under one licensing category. And so the request was just, that the council wanted the board to explore the possibility of simplifying the pathway.
So, Dr. Witcher, so what is it that you're asking us to do?
I'm asking the board to explore the possibility of eliminating the multiple layers of RDA-EF certification by incorporating them under one license. I guess that would be a direction to staff to look into it.
For a future board meeting. Yes. So it essentially, what the proposal is to have the administration of local anesthesia and nitrous oxide as another certificate on top of RDA-EF's license after 2010. And it's OPES's recommendation, and I believe my recommendation, that the board at some point should be looking at whether you want to keep piling on extra permits on top, or at some point whether you want to look at whether the whole RDA-EF program needs to be evaluated and include things that may not be included now. So the recommendation coming from the council is that the board consider at a future board meeting whether or not it wants to streamline the scope of practice for RDA-EFs.
Yeah, don't be confused and think that this is necessarily incorporating local anesthesia and nitrous oxide.
Right.
It's more a approach to licensing, certification, and permits, moving away from multiple layers of certification.
Right.
Because people are having trouble understanding. I mean, we already hear how, people are confused about coronal polish, pit and fissure sealants. We add on all these other layers, and nobody knows what they can do and what they can't. So anyway, it's just a suggestion or a recommendation from the council to the board to take that up.
So the DAC is still going to be forming a focus group of dentists, stakeholders, interested parties to continue to discuss the administration of local anesthesia and nitrous. So that's not on the table for the board at this time. But their recommendation was that the board may want to pursue streamlining or looking into whether RDA-EF scope needs to be reviewed.
Thanks for summarizing that.
And it can be as simple as somebody suggesting we take that up at a future meeting. Yeah.
Yeah, it's a recommendation, so you'll need to vote on it.
Can you repeat that again?
Someone can make a motion to have this issue placed on a future agenda item for additional discussion.
I'll do it.
Chan?
Second,
First.
Letty.
Aaron, second.
Were there two parts to that, though?
No.
Well, no, only the one part came forward. The other is being retained for discussion at the DAC level.
So if you look at your DAC agenda item number 9, the last paragraph before support and opposition will explain that.
Correct.
Okay, I will take that language and put it in here. In the meantime, let's call the roll. Burton?
Yes.
Burton, yes. Chan?
Yes.
Chan, yes. Chappelle Ingram, yes. Lai?
Abstain.
Lai abstain. Laren?
Yes.
Laren, yes. Lay? Lay? Abstention. Lay abstains. Mackenzie?
Yes.
Mackenzie, yes. Medina?
Yes.
Medina, yes. Morrow?
Yes.
Morrow, yes. Alagi?
Yes.
Alagi, yes. Pacheco?
Yes.
Pacheco, yes. Stewart?
Yes.
Stewart, yes. Witcher?
Yes.
Witcher, yes. You?
Yes.
You, yes. Motion passes.
Okay, that concludes the DAC report. I just have one last comment, and that was that several council members requested that if appropriate, the pass rate on the RDA written exam be agendized for a future meeting. With that, we adjourn the meeting. So thank you for your attention. I know that was a lot to get through, a lot of detail. Thanks for bearing with us, and thanks to staff for kind of keeping me on track here a little bit too. It was a lot to go through, so thank you.
I'm hearing we need a few-minute bio break. Is that all right? Let's take 10 minutes. The flyer did indicate that the State University of Medicine Pharmacy of the Republic of Moldova's Faculty School of Dentistry had an admissions office in Encino, California. Karen, on October 15, 2018, emailed a letter to the rector of the school requesting that clarification of a relationship between the two entities, the university in Moldova and the office in Encino, California. A copy of the letter and the response, as well as a copy of the flyer and the website information, was included in your meeting material. The terms of this relationship between State University of Medicine and Pharmacy of the Republic of Moldova's Faculty School of Dentistry and the University of Moldova, USA, were never divulged during the site evaluation conducted in October of 16, despite the fact that the registration of the University of Moldova, USA occurred in April of 2014. So we thought it appropriate to ask the board if they have any additional questions to present to the State University of Medicine and Pharmacy of the Republic of Moldova's Faculty School of Dentistry to clarify this relationship. And the university has identified Senator Polanco as its representative, and he has agreed to be here today to help us understand some of these clarifications. So with that as a background, I will open this agenda item to the board for any questions or concerns.
Thank you, President. Welcome. Thank you for taking the time and the energy in this weather to come and join us. Appreciate it. Just for your knowledge and your record, Senator Polanco and I go back all the way to Moldova, Chisinau. Senator Polanco was present at the university during our site visit team's assessment of that educational program. He was not involved in the assessment process or the interviews, but he was there directing traffic, so to speak, and One of the concerns that I have is what Dr. Stewart mentioned, and that is that during the site visit, it was not divulged to the site visitors that the university engaged the services as independent contractors of organizations in other countries, and I believe the letter stated something around 30 countries, including the United States, for services relating to recruitment, for marketing, etc. Unfortunately, we were not, advised of that, and as a result, we were not able to ask questions or get additional information regarding those agreements. So, at this point in time, I think that the board should be made available copies of any memorandum of understanding or affiliation agreements that the parent university in Chisinau, the Republic of Moldova, has, specifically with the University of Moldova USA Incorporated, so that we can assess whether or not that memorandum of understanding affects control and decision-making as far as the university is concerned. So that would be, number one, my request to make available to us the written documents that are supporting those agreements that you have. I would say with other institutions, with other countries as well as the United States, I would like to see that they're consistent. In other words, that we don't have a different agreement with one country and with another. Secondly, we also requested, the board provided a provisional approval with a 24-month time period by which some supporting documentation be provided for some deficiencies that the site visit team identified and reported to the school. Those deficiencies were documented, were sent to us. Documentation of those deficiencies were sent, and the board approved final approval of the institution based on that documentation that was submitted to us. Shortly after that, we received a notification that your university had instituted an international dentistry program, which was not divulged to us again at the time of the site visit. There was some question as to whether or not this represented a change in scope, in change of intent, in change of mission as far as the university is concerned to establish an international dentistry program. We then asked for some information regarding your admission requirements and et cetera for that, and well, I would say we were partially satisfied with what we received, but I will have to say I was not completely satisfied with that. Another concern that I have, again, has to do with any changes that the university might make, and I will refer back to the site visit team's report that was submitted to the board at our December 2016 meeting, which recommended to the board, and the board accepted, a provisional approval based on documentation of the deficiencies that were identified. But in that, in that report, under standard C1, which has to do with curriculum as far as the school is concerned, the program, it states, the report states, the curriculum includes 5 years. However, starting in 2016, academic program will be 6 years. Has that been fulfilled?
The correction has been made. It's a 5-year program. It was communicated to this board in correspondence. There was discussion as to whether it was 6 years. We corresponded indicating that it was a 5-year program.
So is that a yes or no?
That's a yes, that it is a 5-year program.
Well, according to our report and the site visit team's report to the board was that it will be a 6-year program beginning in 2016?
There is correspondence to the effect, again, that the approval is a 5-year dental program. The curriculum is based on a 5-year curriculum, and it was reviewed by you and the team. It went through the process. We received approval, and we acknowledge that it is a 5-year program.
It appears as though we have a communication breakdown.
I believe so, and I believe that's all it is.
Another issue that I want to bring up, and that is the flyer, the information that is being put out by the University of Moldova U.S. Incorporated has some inconsistencies with what the site visit team reported and observed. Okay, first of all, the material that's provided by University of Moldova Incorporated states that acceptance is immediately after graduation from high school. Is that correct?
Restate the question again, Dr. Morrow.
The information provided to prospective applicants through the University of Moldova USA Incorporated states that acceptance into the dental education program can be accomplished immediately upon graduation from high school.
Yeah, the requirement is not a 4-year university requirement. That is correct. That is current practice at the university. And I believe there was discussion to that effect. In this one of these board meetings, the question was asked, how is it that a high school student who passes an exam can qualify? Your response, Dr. Morrow, was with regards to the European standard of education is heavier in the sciences and in other areas that we here in the United States do not place a lot of emphasis. So it is a consistent, uniform policy of the university that a 4-year college degree is not required. They will take an exam, they will pass, if they pass the exam, then they meet other requirements, then they would be accepted. That is correct.
According to the site visit team's understanding and report to the board was that the first year of dental school, in the first year of dental school, foreign students, and would we consider that citizens from the United States going to Moldova would be considered by the university as foreign students?
A foreign student would be considered a U.S. student, yes.
Great. So in the first year of dental school, foreign students are required to enroll in Romanian language courses and basic science courses. After the completion of this first year, foreign students are required to take a competency examination. Now, is that still in existence?
I believe there have not been changes to what the requirements are as presented and approved by this board as it relates to the 5-year curriculums that this board received. My answer is they were received, prepared in a 5-year curriculum. They were reviewed, they were approved by the site committee and given a recommendation to this board, and this board approved that 5-year curriculum.
It was the site visit team's understanding that foreign dental students to the school, dental school in Moldova, was a 5-year curriculum plus the preparatory year of Romanian language and also science courses. Now, that was our understanding, and that was what we were told by the university.
So my request would be, Dr. Morrow, on this particular point, again, I did not participate, as you indicated, in the site team review. I was not allowed to. And so what was conveyed there was between the university representatives and the site team, yourself, Dr. Martinez, and Dr. Plesh. So I'm at a disadvantage as to several things. One, we had asked if some of these questions could be provided in writing so that we can come and present accurately. I will present honestly and accurately to the degree that I understand based on my experience as it relates to this particular process. So you're asking me currently, Doctor, a question that I would defer. I would ask that this board provide the university with a list of the questions that you believe need further clarification. And to the degree that I can respond, I will do so.
Okay. I believe that can be accomplished. However, since you are here with us right now,
Mm-hmm.
I would like to continue with a few more questions, if you don't mind. Okay?
Is that a real question?
That's a question, if you don't mind. If you mind, say no. You want
I would prefer,
I
would prefer to have this in writing. We requested in the letter to Ms. Fisher that if there are any other further questions, that please provide them in advance so that we can. That request was made, and we did not receive them. I'm hearing these questions today for the first time. It says, and I'll read it, I would appreciate if you could forward the questions and maybe we can answer these in writing without the time and expense of the trip to coming out here. So my request was, look, we have been, will continue to be as transparent with this process. It has been a very extensive 2-year process. It didn't happen in a vacuum. And so my request at this point would be for the board to be kind enough to give the consideration and provide us the questions that you have prepared so that we can, in fact, respond to them very accurately without any misunderstanding or misrepresentation or confusion or lack of clarity.
And I would like to interject at this point. The initial questions were submitted to the school based on what I was asking. This, and the reason why we asked for a representative who would be able to answer additional questions to attend this meeting was because it's unknown what other board members would have as questions. Do you understand that?
I do, and again, my request would be in the interest of just fairness and some true transparency. Let's put the questions in writing so that we can get them back. I'm reading your letter here. You had 4 issues that were addressed. Location, whether or not there had been a move, the university. The letter clearly states that the dental school is not making any changes of location, mission, purposes, or objectives changed in the shift or control of the university. It's a state university. It cannot have any kind of shift of control. That is a state government entity. It goes on and it made reference to having some clarification on specifically the University of Moldova, USA. In this letter from the rector to Ms. Fisher, it is the practice to contract with entities in certain countries to perform marketing, recruitment, intake of applications, represent the university at dental conventions, advertise in public social media, and do special outreach to attract students to attend the university. This is a common practice we have. This is the rector making this statement. The University of Moldova, USA is the exclusive entity for the United States. They are authorized to perform on the above scope of services as independent contractor. This entity is licensed to operate in the City of Los Angeles. A copy of the license from the City of Los Angeles Office of Finance is attached. I understand that they are in good standing with the Secretary of State as we would require. In Ms. Fisher's letter, she indicated that they wanted proof copy of that City of Los Angeles license. It was provided as an attachment to this particular letter. They go on and they indicate that for the record, University of Moldova, USA, Inc. does not conduct interviews or make assessments to determine student admissions. As required by our rules and regulations, the Dean of the Dental School and faculty review and evaluate the admission documents, make assessments, and conduct interviews of the applicants, and the final authority for admission and denial rests with the Dean of Admissions. It goes on and it says, to accommodate the students from not having to travel to the Republic of Moldova for their interviews, we utilize the conference room of the University of Moldova, USA, Inc. All records and documents of applicants are maintained at the University of Moldova. I hope this letter clarifies the contractual relationship we have with the University of Moldova, USA, Inc., and has provided you with the information you requested thus far. In addition, I understand you are requesting a representative of the university to November 29th, 2018 board meeting to answer questions relating to the university. I would appreciate if you can forward the questions and maybe we can answer these in writing without the time and the expense of the trip. Please copy these to Senator Polanco, retired. If we can answer the questions to your satisfaction, if we cannot answer the questions to your satisfaction, we will make arrangements for our representatives to the board meeting. If the board has any questions, please send them to my attention, meaning the rector, and to Senator Polanco.
Senator Blanco, I understand that you are that representative.
That is correct. That is
Okay,
correct.
so
And-
that's why I'm asking you the questions I'm asking you, and you seem to be refusing to answer them.
No, I'm not going to refuse to answer them. I'm going to answer them in the manner that I believe are factually certain and correct. And I'm asking that this board communicate in writing the questions that you have now brought up, so that, as the letter says, if there are questions that need to be answered, in the interest of fairness, I would suggest that they be forwarded in writing to us. Those questions that I can answer, I will answer. So it's not that I refuse to answer, Dr. Morrow.
I have another question then that I will ask you, that I want to ask you. As a representative from the University of Moldova in Chisinau, Republic of Moldova, at the university, what committee or organization within the university establishes the rate of tuition for international students in the School of Dentistry?
I believe the university establishes its tuition rates,
Okay.
and the university publishes them, and the university is in charge of what those are.
With that said, sir, I accessed the parent university's website in Moldova, and according to the information I found on that website under international students, tuition was listed in euros. Converting that euros to, and this was for 2019-20 academic year, tuition for international students at the university was 4,100 American dollars to $5,193. There was a variance there per year, with an application fee of $56 US. Now, on the University of Moldova, USA Incorporated's website, I obtained the following information regarding tuition. University of Moldova Incorporated, USA Incorporated, tuition $25,300 per year, with an application fee of $175. That is significantly different than what the parent universities established and published tuition rates are for international students. Could you explain to me why the difference exists?
I can only respond that the difference exists because the university, in some form of an agreement, has agreed to allow for the tuition differentials to occur. Again, this will be an issue that I will bring to the attention of the university representatives as to the issue of tuition. Let me also just say that the tuition issue is much less, obviously, than the United States, and the difference here will need to be explained and can be explained by the university.
I would hope so.
I'd like to interject at this point and reiterate that the purpose of this meeting was to try to get some of these answers from questions that we didn't know board members were going to have from somebody from the university who would be able to answer the questions. And the expectation would be that the questions wouldn't be trick questions, that somebody from the university should be able to answer these questions pretty well on the spot. So I appreciate the travel, time to make the arrangements. All that being said, I think that this is an opportunity for board members to start the questioning, and whether or not, Senator Polanco, you can respond, staff is writing down the questions, and the expectation will be that a meeting of the very near future, a representative from the school will be attending in person. We will have a translator available should that be necessary. But I think it's also important to have somebody attend who participated in the site visit. I recognize you were in the country at the time, but these predominantly are educational questions, but there were a lot of things that weren't brought to our attention, and I would hate to see the school respond, well, you didn't ask the question. So moving forward, if we can, now if board members are comfortable, let's start listing the questions that you may have regarding the school. Do you agree, Dr. Morrow? Okay.
I'd like to ask a question, and if we can get an answer to what are the names behind University of Moldova, Inc. in
USA Inc.?
USA.
Okay.
And are those folks being compensated for the work that they do?
So you'd like to know the names of the officers of the Corporation of Moldova USA?
Yes.
And whether or not they're being compensated?
Yes.
Next questions?
Whenever you're ready.
So pertaining to that, I would like to know if there's a tax ID number associated with that. Is it, if there was a tax return, and who paid the initial business license? So that's 3, sorry.
I have a clarifying question.
Abigail.
I have a clarifying question. So maybe just for me to understand, because I was reading through it, what is the and I know it says in here, but I just want to hear it from you maybe to help me understand the relationship between the University of Moldova USA Inc. and the relationship in Moldova.
So you have the university.
Mm-hmm.
The university has, in pattern and practice, hires in various countries entities to do the recruitments and assist in processing and identifying students. The University of US Moldova, as it listed in the letter, provides those similar kinds of services. Recruitment, going out and presentations, conventions, basically marketing and public relations for the university to attract California students.
Okay, and the reason why I was asking because of the tuition difference I was just curious, when the students that attend Moldova USA Inc. don't attend the university there? Or they, because I noticed something about the conference room, that they, if they do, they go into a conference room?
No, there's no classrooms or instruction taking place at Moldova USA, none whatsoever. What takes place is by the deans who come for several days, and they administer the assessment and the interviews for purposes of selection, making recommendations to select students. USA does not.
Okay. So if a student was to reach the one in Moldova, they would get the discounted price? Do you know?
All students, the tuitions are the same.
Thank you.
So, just, if I could just follow up on that. So, you are calling yourself a university, the U.S. entity, because the deans come here?
No, the name was established with the authorization of the university, provided it had the USA Inc. And so that relationship is a contractual relationship between the university and this entity.
But you are not called the University of Moldova USA.
No, the registered name is the University Moldova USA Inc. The USA is the distinction.
Okay. But you're not a university.
What
you have in Los Angeles is not a university.
Yeah, it's not a campus per se. No,
Okay.
no.
But by virtue of the deans coming here, then that allows you to use that title?
I'm not sure if to answer Fran, if it allows to use the title. I think the title was authorized and okayed by the university so that there can be that link between the two.
Okay.
It does not establish the Los Angeles office as a campus where you provide educational classes per se. Again, more of a marketing scope of services defined in the letter that was provided to.
But you do conduct the interviews and the testing there.
They are conducted not by the University of Moldova USA, not by them. To save costs so the students wouldn't have to go to Moldova, the deans come to the conference room and conduct the interviews. That is how it's done, and that's the degree.
Okay. Now, going back to the license has a 2014 date on it. Now, I didn't participate in the site visit either, but the site visit wasn't until 2016. Can you explain why you existed 2 years?
I will answer this way, and I will get a more clarity on the answer. It took 2 years to go through the process, and there were discussions taking place of which I was, at that point in time, not part of. So I will ask that this be a question as to why the differentiating dates. It could be that the principal of Moldova USA, was already having some form of discussions with the university without any, they may have been having discussions. And so, but let's list that and I will get a more clarifying answer to that.
So you were not a part of that license in 2014?
Yeah, I'm not listed as part of the license. for the city of Los Angeles. That is correct. Yeah. When I began involving myself in this, originally it goes back to La Sea. That was my first engagement in this particular way of allowing for foreign dental schools to become certified or accredited to California, equivalent to California standards, educational standards. So that was some time ago. And then the Moldova, I will be, it had to, no, not had. Let me get you more specific years and dates when the engagement with Moldova. I know that there's an official letter that I was required to be submitted to this board with the university letterhead designating me as that individual. And so it should be in the files with the board designating me. And so that would be the official starting date of participating in this particular accreditation process.
Do you know the size of the student body?
Yes, there are about 6,000 students. Moldova is like the size of Los Angeles. It's like 3 million plus people. It's a small country, it has its medical and pharmacy schools are nationally recognized and accredited by national organizations. Yeah, it's about 6,000. 6,000 students.
And so how many of that 6,000 are people who have enrolled in the university?
I think to date there are, don't quote me on it, but I believe it's about 20 students.
Okay. All American?
Yes.
Okay.
Yes.
I want to ask a question as well, then we'll Senator Polanco, you've clarified that it's a 5-year program, and my understanding is that because the European model is a little bit different than the American model, maybe the students over there are getting more science earlier, and they're more grounded in some of the core subjects than we are in this country, so that as they go through their dental experience, there's an equivalency of their education and our education. I think that's what we were resting on, that you know, they could be eligible to take the exam, pass them, and be successful in their careers. But I also heard you say that this flyer makes, it says the only dental school in English outside the United States approved by the dental board. Now, if they're teaching in English and yet there's a requirement for us to study their language, could you help me understand what that is? What's the purpose there? I'm assuming that the dental school is in English?
Yes, the courses are taught in English, which is a very great advantage. And the Romanian language is the language that is spoken. And so it would be a requirement that the university has for the language of Romanian in order to communicate with patients, obviously, would be recommended, is recommended. Yes, so the courses are full English.
That's helpful, thank you. And I saw Dr. Yu.
Yes, I do have family living in Europe. I'm not quite sure whether the high school science can make them so qualified that they can as good as our college graduate. That's my first question. When I was a student, applied for dental school, California has one of the highest standards found in the world, at least in the United States. And we all are very proud of when we get accepted in dental school. So it's kind of a shock for me to see a flyer, and I'm sure you read this flyer, okay? Yeah, straight from high school, no college needed, okay? That is the first word I saw. and then fully approved by the Dental Board of California. And no ACT, SAT, DAT required. So, I mean, this is a marketing technique is fully taking advantage of the Dental Board of California, and also the arrangement that before I become the board member. So this is something that is, to me, shock. Yeah, and I think we should look, clearly into this again, the relationship and also the arrangement.
May I just make a...
Dr. Lay?
Could I just make one quick comment? I'm a graduate of a European high school system. Okay, I went to high school in Vietnam. We do have the French, the French high school system there. And I can tell you it is absolutely no equivalent to college education. I came here, I went to college before I started dental school. So just to let you all know, I am very familiar with European high school system because I'm a graduate of one. Having said that, in the site visit, I know, I'm sorry, I'm jumping line, but I know that in the site visit and also in your argument, Senator Polanco, that you made a very strong argument. The reason that the students that get admitted into the school are somehow better than American high school, and therefore they don't need they don't need college education to begin. But then now it seems to me like you're lowering that criteria for admissions by admitting American high school graduates. So can you justify that?
I think the marketing is of your concern. Both your concerns is the marketing and the manner in which it's being marketed. Those are facts. Those are factually correct. It's not misleading marketing. It may be leaving the wrong impression, but they don't have. I mean, they're going to have to pass an exam in order to be admitted, and so if the board this obviously is leaving a distaste to the board in terms of the marketing, and that is something that we would I will definitely make the commitment to, revisit and create a different approach to the marketing. It's not meant to demean anyone. It's not meant to. It's really to entice individuals who. We have STEM programs. We have STEM students. We have some very gifted schools, public schools and charter schools, and some of these students would want to come and take the exam and may pass the exam, but for the considerations of the costliness in the four-year university, the costliness in taking the preparation tests. There's a lot of financial considerations that people have to make, and so I hear doctors, the marketing should be reviewed and looked at, and you got my commitment that I will definitely convey that.
I think it's more than the marketing. It's also, like Dr. Lay mentioned, it's lower down the standard of the application from college to high school. And say, from Hong Kong Dental School, the Hong Kong Dental School is one of the top dental schools in the world. And I think they're either 5 to 6 years program. Their graduate is only BDS, not DDS, Bachelor of Dental Surgery, because of they are not finished, they haven't finished the college before they come to the dental school. So they got BDS. On top of that, when they come to this country to practice, they need to attend an international program, which is another 2 years of study. So now for the student from your school is just high school graduate, attend the school for 5 years, and also 1 year for Romanian language study, something like that, and qualified to be the student, to be the dentist, to take the test.
So, Doctor, what do you say to a student who goes through the program, albeit graduates, and has met the California standards, has met other university standards, and comes and takes the exam, passes the exam, and gets licensed? isn't that the success story that we should be really focusing on? Because that is going to be a reality in a short few years with the students that are there.
To your argument, that means United States, California, we should all accept students from high school to attend dental school. Is that what you mean?
No. The countries, we need to honor sovereignty of the countries and their rule of law, just like we expect them to honor ours. And this board, when this legislation that allowed this particular process was created not in a vacuum. This was created with the strong support of the Dental Association. In fact, they sponsored the bill. And the issues were, do you lower the curriculum or do you lower the standards in order to allow a foreign-trained student or a foreign-trained dentist? Do you lower the standards so that they can come and apply for the exam? They couldn't do that today. And so the strategy and the policy was allow for foreign-trained or foreign universities to apply and go through this process, which is a rigorous process. When you have a team like Dr. Morrow and the other two, it was rigorous. And you come through a process that basically was created to do what La Sella has done and what we're attempting to do with Moldova. That's the public policy consideration.
I have to offer maybe a correction. The thrust for the legislation looking at the international schools was to address a perceived shortfall in the workforce in this country for treating the Hispanic population. That was the thrust. But I'm going to leave that there. And you're at a disadvantage. There's gaps here from what we're seeing and then what you're addressing. So let me offer one more piece, and it's item number 7 in the letter. And it talks about applying for a license to practice in California, completing the program, the California required exams or the National Board exams, part 1 and 2, and then the REB regional board. But then it says most students will be able to take the exam during the 5th year of the program. And that would be another question, how do you address that inconsistency? Typically, you have to complete your degree before you are able to take the Western Regional Boards. So that's a question, you don't have to answer that, but that's a question.
And he's referring to a snapshot of the website, Monrovia University, the website. So it's not a letter, it's just part of the website, I believe it is.
All right, I have, the order that I have is Yvette, and then I'm going to go over this side. So Yvette, you've been waiting?
Yes. The issue of U.S. citizens, let me just say this. The marketing can be very compelling to a high school student. Just like any other marketing can be compelling. It is compelling when you indicate that you don't really have to go to college. And I'm just piggybacking on what Dr. Yu and Dr. Lay had mentioned. So, in a nutshell, can a U.S. citizen apply, go to Moldova, and then come back and practice dentistry in California? Yes? Okay.
The answer is yes.
So I think what is probably more troubling to me is not just because the marketing is it's very compelling to a high school student. But what is more troubling is the agreement and that the board is not getting regular, updates and have to go to, more or less websites and then have to ask you these questions. I think that they should come voluntarily, and so that shouldn't be asking you all of these questions. This should have come. And again, the discrepancy between the MOU and what is being done. I'm a little disturbed about that. I'm a little queasy about that. So.
Let me qualify my answer to when you indicated, once they graduate, they can come here and practice. Once they graduate there, they come here and take the exam. If they pass the exam, then they would be able to practice.
Yes, yes.
That's the correct answer.
But it's, again, it's very compelling. It's very compelling to a high school student. It would be compelling to me if I were 17, 18 years old. But needless to say, the profession can speak more to that than me as a public member.
All right, thank you. We have some questions on this side. You're going to have to help me with the order because Dr. Witcher?
Yeah, I have two. Is there anything that would prevent a U.S. student, like any other international student, from applying to University of Moldova directly?
No.
Then that would indicate more that the relationship between Moldova USA and the university is one that involves marketing, recruitment, and intake of applications, rather than that there was control of one.
No, they can go directly there.
The other question I have is, and again, the website seems to have a lot of issues. There is a disclaimer on the website that says USMF USA reserves the right to modify or change admission standards or requirements at any time without prior notice and effective immediately. I don't know if that doesn't, I think the intent of that disclaimer may be something different than the way that it comes across, but it indicates to me that Moldova USA is directly responsible for admission requirements and standards and requirements. So I would ask for some clarification of that statement. That's off the website.
Thank you.
So I think, again, just for my purposes, I'm disturbed that this didn't come up during the site visit. I think we have unanswered questions regarding the duration of the program, because the Moldova website does have an international tab that states very clearly that you apply, you do an initial year, involves Romanian basic sciences, you test, and then they review those results. And it's not clear to me whether you have a guaranteed spot into the 5-year program. But the program is listed as 5 years, so I think some clarification there. And I'm just following on with Dr. Morrow's question on that item. So those are the questions that I have.
Fran, are you?
Yes, yeah. Now, I'm really confused, and based on this question, because my understanding in the beginning, and one of my concerns in a very first initial review of the material was that you had students who were going from the U.S. who could go with a high school diploma, but you had students who were already there, and their requirements as Moldovan students or international students were different. They could not enter this program from high school, right?
No, the requirements are uniform across the university. That is incorrect, Ms. Burton. So the response is no. There's uniformity on all the requirements, which is not just there, but we have to comply, with our California regulations and rules. So uniformity across the state. Otherwise, it would be discriminatory.
Okay. And the second question is the disclaimer, the last thing on page 2 of the back and front Moldova State University of Medicine that says USA reserves the right to modify or change admission standards or requirements at any time without prior notice and effective immediately. The information provided on this site is for informational purposes only and does not create an agreement or understanding or establish any rights or responsibilities whatsoever. So doesn't that in effect allow you to give you a leeway to make changes?
One could argue that it does, but the fact of the matter is that the ultimate decisions rest with the university, and the university has established all the admission standards, the curriculum, everything that needs to be adhered to comes from ultimately the university and not from Moldova, USA.
And so that brings back a question that I would have asked, that I had started to ask initially, and that is, the university talks about your authority. What establishes that authority?
It's a contractual relationship that has authorized this entity, the Moldova USA entity, Inc., to represent it exclusively. And so by virtue of having been designated, it gives that entity within that scope of work to perform. And that scope of work to perform is listed in the letter to include social media, outreach to, social media, dental conventions, recruitment, intake applications. It's the the fourth paragraph in the letter.
Right.
So that's the authority by which the entity has been entered into an exclusive agreement. There's no other entity in the U.S. that can engage. So it's an exclusivity clause, if you will.
So then, couldn't one argue, if that's the authority, that this disclaimer is really confusing? Because it's outside of...
Yeah. I think two things are that the website and the manner in which the marketing and the flyers, obviously that will get addressed. I think that this issue that needs clarification, and it will get addressed. And so I just want to be clear that the authority that is referenced is really within that scope of the exclusivity agreement between the university and Moldova USA.
And the other thing that I wanted to say, and I think it was Dr. Chan who may have said this initially, I see De La Salle and Moldova as two different things, established for two different purposes, in my opinion. Because De La Salle had something to do with the disparity of the number of practitioners. And so to continue to talk about them together only adds to the confusion.
So I only reference it for basis of my experience with both. They don't need to be discussed together. They can be discussed independently. The intention, and my intention has always been, for those who know my history, is to increase the participation of people of color in our professions. This was one way to begin to address that.
Is that happening with the 20 students?
And we have 20% who happen to be of the Latino students. So It's slow in coming, but it's going to happen. And the intention has been always for the students upon their graduation to come back into the health manpower shortage areas that exist up and down the state. The studies that have been commissioned by this board validate the need, the ever-growing need of dentists. We have 6 universities. There's capacity that it levels off. We have to do better than that, and we can. And this is a vehicle that was put together from a public policy perspective to address that particular need. When I said I wasn't going to do this, but with LASEA, you all have the addresses of where the 60 plus or 70 students who have graduated over the 12-year period of time, these students who come back to parts of San Diego, come back to areas that are health manpower shortage areas. So I hope that the board looks at it beyond just the present issues. This is, the come from has always been about creating the opportunity. And maybe the marketing is distasteful to some, but those are factually correct statements. They don't have to do the following. And we'll take a look at that. But the intention has always been to increase the dental pool and do it in a manner that does not lower the academic standards for purposes of protecting the public.
Okay, I think, Dr. Morrow, did you have a point or question?
Again, I think part of my concern is not only approval of an educational program upon application, but it is also to continue monitoring compliance with the educational standards that are established in regulations during that approval process, which is for 7 years. And we have regulations that identify and specify how that monitoring can and should take place. And obviously one of those is a reported change in some aspect of the educational program. And obviously the regulation identifies location, mission, purpose, and objectives, change in name, shift or change in control. Now, when I read a disclaimer on Moldova's U.S. Incorporated saying that they have the power to change admission requirements, then that's telling me that the parent institution relinquished control to Moldova USA Incorporated, which is in violation of 1024.8. You have changed control. You had shifted control by giving you, Moldova Incorporated USA, the power to change admission requirements. And that's not in compliance and could result in this board deciding as regulations state to lift approval, remove approval from that institution.
Or I would ask for the board to allow for cure so that there is opportunity to cure. This is a website statement that obviously has created an important issue, and so I would ask this board to allow for clarification and for that particular issue to be cured, which would be not unusual for ways of remedying matters.
Thank you, Senator. Dr. Lai.
Just one comment. I think the board's main mission is to protect the public. The students that are applying to this organization is part of the public. When there's advertising or there's a false hope of changing their whole world. I think we need to protect these people that have a mindset that they're going to help their whole family and my understanding is people pool money together because it's not a California, it's not a United States school. There are no loans for education outside the United States. That's all private. That's all people pulling money together. My hope is that we protect people that can't really afford it, but have the false hope. And that's my statement.
Dr. Lay.
So I have this question. It's probably for Spencer, but also for the board. And you just let me know if I'm totally out of line. I'm fine with that. Earlier, we were talking about the faculty permit. We were so concerned about the fact that we can't monitor the faculty permit holders, whether or not they are doing the CE requirements, whether or not they're doing, all these courses that are mandatory. We're not even addressing that with the faculty of these 2 foreign dental schools that we approved. We also talked about the mission of the dental board, which is public protection. We approved these 2 schools. These are future dentists that will be licensed in California. What is our responsibility to the patients that these dental students are taken care of at these dental schools? Do we have any responsibility at all to those patients? I think those are the things that has not been brought up, and I just want to bring it up because, in a way, because these are schools that we approve. What is our responsibility for the care that's being provided at these schools?
That is a separate issue, because this relates only to the approval of the foreign dental school and whether or not the school is in full compliance with the board's regulations. And as Dr. Morrow correctly stated, that if the school has made a change to its program, one of the options would be for the board to withdraw approval. However, the board has provided Mr. Polanco with questions for the university to respond to. So, although the board has not posed a question yet, but I believe that Senator Polanco should be given an opportunity to have those questions responded to and then have the issue brought back to the board for further consideration and possible action.
And if you'd like me to give the list of the things that have been discussed to this point, in terms of what we would be requiring further clarification, I'd be happy to do that.
Let's wait until after everybody has a chance, because there's still a couple of hands.
I see Meredith with a hand up.
Yeah, I just had kind of one additional thing that I wanted to say, kind of, I guess, maybe before we summarize. So you said a little while ago, and then I think you started to go down that same path, that the statements in the flyer are factually true, and you had previously said, so therefore they can't be misleading. That's actually incorrect. You can have factually true statements that are misleading, and the law in California does take that into account. So you can have issues even with true statements if they're used in a misleading way. So misleading is misleading. So just the fact that they are factually correct does not get you out of having an issue with misleading. And then in addition, of course, we have the statement that's either a false statement about the disclaimer or you guys have relinquished control. So that also needs to be clarified. But
Thank you.
I think this has been a helpful discussion. I think it's been a good discussion. And I'm hearing that I forgot to ask for public comment. Seeing none. Senator Polanco, thank you for being with us.
Are you going to review the questions so we can make sure that, are you going to review the questions now or no?
We can't hear you.
Are we going to review the questions now? I just want to make sure that
or no?
Well, before we do that, let's, Fran has another comment she
Okay,
wants
go
to
ahead.
make, and then maybe I can ask our executive officer to, are you prepared to review the questions, or do you want?
Yes.
All right.
My question, I think, is probably more a procedural one that perhaps is to council. And that is, I'm hearing a lot of confusion. And I don't want to say dissatisfaction, but it comes close. And so my question is, what are our options if at this point there is a strong feeling that there is a change in status? Can we ask for, can we return to provisional approval pending someone from the university? I also don't want to put you on the spot. And I think that it would put you on the spot if there are questions and you come back with answers from the university that lead to other questions. So my question to council is, what are our options? If what we wanted was someone from the university, can we ask for a return to provisional approval until we can get someone here to answer questions that have been supplied in writing and other questions that we may have?
Not at this point. It wasn't agendized to allow that. And Mr. Polanco was only invited here, or the school center representative, to respond to questions. However, if upon receipt of the additional information, meaning the response to the questions and copy of the MOU or contract regarding the relationship, then at that point, if the board makes a determination that a change was made that was required to be, let me change that, in which required the board to be notified of that change, then the board could move to withdraw approval of the dental school. At that point. And CCR section 102.8B authorize the board to request any information, documents, or other evidence in order for the board to determine whether the change will affect the institution's compliance with the requirements of this article. So it's wide open at this point with respect to what the board wants.
So does that mean that in the interim, the school can continue to accept students?
Yes.
They would be still available to do that if it was provisional.
Okay. Okay.
I think everybody's in a coma at this point. So I'll just run down the list if you're ready. And if I've left anything out, please tell me. So we started off with a request for the affiliation agreements between the parent company and USA. When I say parent company, I'm just referring to the university actually in the country of Moldova. We want an explanation of the tuition disparity, and Senator Polanco, you don't have to write these down because we will put this in writing for you. An explanation of the disparity in the tuition that we've uncovered, the names of the officers of the USA Moldova Incorporated and whether or not they're compensated, the tax ID number and tax returns, who paid the registration initially, is the organization registered with the Secretary of State of California. It's been mentioned that in the university's response that they hire these types of consultants in other countries. If so, what are the countries and how long have they been doing this? Moldova, does the parent company of Moldova approve the marketing material that is disseminated here, including website postings and/or flyers and any other recruitment. Does Moldova USA recruit outside of California? Why is the amount payable on the website says that it's payable to Moldova USA? How many students have been recruited into via Moldova USA? Clarification of the disclaimer that's on the website regarding Moldova USA's ability to change the admission standards. And clarification of whether or not foreign students need to take an additional year before being accepted into the 5-year program, or what is the understanding of whether it's a 5-year program or a 6-year program, or did I miss anything?
Yes,
The director?
I think you missed Dr. Morrow's first question.
The director's
about,
one, yeah.
Why wasn't the site team advised in 2016
Okay.
of this relationship that started in 2014?
Okay.
I also wanted, unless you mentioned and I missed it, where the board of directors or the people that are part of the board, if they're being compensated?
Yes, I had that.
Oh, you
on
did
my
mention
list.
that. Okay,
Yes.
great.
Thank you.
Bruce?
I guess my question was answered, but I just asked if it would be possible for a U.S. student to apply to the university directly, not through Moldova USA. And the answer, I believe, was yes.
Yes, you did. It was yes.
Okay.
But would
We
they
can ask-
get the discounted price of Monrovia and not the USA price?
Well, we did have on this list to explain the disparity between them.
So I probably didn't phrase it as a question, but maybe I would add just, what does the university do to control the USA entity to prevent misleading statements? That kind of addresses one of the comments Dr. Lai had for protecting the current public.
And you talked about the tuition disparity, but I don't think you included in that who sets the rate.
Okay. So you can see, Senator Polanco, there is no way that I would have been able to provide you with these questions prior to you coming to the meeting. We do like to conduct our board meetings in an open way to allow all peoples to have kinds of questions, and based on the information that was provided, that's how these questions were essentially developed.
Okay, I think we're ready to move on, and thank you, Senator Polanco.
Mr. President, members, thank you very much. Appreciate the honesty and the openness, and we'll get back to you with the appropriate responses to each and every one of the questions. Thank you.
Thank you.
Do we want to respond by the next board meeting? Do we need to set a time?
Oh, Senator Polanco, if you could wait just one moment. Is it the board's pleasure that, of course, these questions will be disseminated immediately to the parent Moldova University. Is it the board's will that they bring the answers to the next meeting in February with a representative from the school who actually participated in the site team? Or what's the board's pleasure? Do you want them to provide the responses to these questions prior to the meeting for you to review and then have a representative attend the meeting to be able to respond?
Yes.
Okay, so I'm going to, when we send this, Senator Polanco, we're going to ask that there'll be a time certain for you to send the responses, or the university to send the responses in enough time so that we can get them in the board packets.
Thank you very much. Appreciate it.
Right. Ms. Yvette Chappelle Ingram just also mentioned that the representative should be prepared to expand on any other questions that may arise out of these questions at the February meeting.
Understood. Thank
Okay.
you very much for your time.
Okay.
Thank you.
Thank you. All right. I think at this point, are we, do we have energy to go to closed session? It's 5 o'clock, 5 after.
You're the president.
Well,
And Ross is
okay, so the option is to go to closed session now or to go at 8 o'clock in the morning. The option is to go to closed session now or to go to closed session at 8 o'clock in the morning, but the closed session would have to be done by 9 o'clock.
I say let's do it now. Get through it.
See what we can get through, right?